competence in the clinical skill of intramuscular injections is demonstrated by uploading 10 videos for review by the course instructor. The technical requirements for these videos include real-time continuous audio and video throughout the clip with no evidence of editing. Additionally, each video uploaded must be accompanied by a signed consent form that includes consent for the student, supervising clinician, and patient or model to appear on the video, and for the patient or live model to receive an intramuscular injection. A sample consent form is provided in the intramuscular injection module. The signed consent form will include a provider's order for an intramuscular injection. The medical assistant must read the order aloud, select the correct medication from the tray, and select the correct needle and syringe from the options available. After cleaning the med bottle with an alcohol wipe, he or she withdraws from the bottle the correct amount of medication. The medical assistant checks for air bubbles and removes appropriately and presents the medication for review and approval by the provider. The patient is not usually present for this step in the actual clinical setting, but may be present when using a live or simulation model. The medical assistant should verbalize the steps involved throughout. For example, I have an order to give Benadryl 50 milligrams IM from Dr. Smith. I've selected the bottle of Benadryl labeled 500 milligrams per 5 ml. I've selected a 1-inch 22-gauge needle and a 1 cc Luer lock syringe. I've opened an alcohol wipe to clean the med bottle. I've assembled the needle and the syringe. After cleaning of the med bottle stopper, I am withdrawing 0.5 cc's of air into the needle to inject into the med bottle. I'm now withdrawing 0.5 cc's of Benadryl, which is equal to 50 milligrams. After removing any air from the syringe, I will recap the needle and present to my provider for review. Dr. Smith, please confirm. I have an order for Benadryl 50 milligrams IM. I've drawn up 0.5 cc's of Benadryl 500 milligrams per 5 ml solution from a multi-dose vial for IM administration into patient Jane Doe. The provider will confirm that you have prepared the correct amount of the correct medication and instruct the medical assistant to proceed with the injection. The student will introduce him or herself and his or her role as a medical assistant. The student should also identify and introduce the clinical supervisor present for this invasive procedure. The student will explain the procedure to the patient and the steps involved. As part of the initial introduction, the student should confirm the patient or model's understanding of the procedure and elicit their verbal consent to proceed on video. For example, "Hello, my name is Joseph. I'm one of the medical assistants here in the clinic today. Can you tell me your name and date of birth?" "Thank you. Here with me today is my clinical supervisor. His name is Dr. Malik. As you probably know, your provider has ordered a medication called Benadryl to be given by injection into your upper arm. Do you have any allergies to medications? Have you ever had this medication before? Were there any difficulties with this medication in the past? No? Good. Are you left-handed or right-handed? Right. Then if you're ready to proceed, I'll ask you to roll up your sleeve on the left while I wash my hands and get some gloves. This injection will be like other injections you've probably had in the past. I'll clean the area with some alcohol, insert the needle, withdraw the plunger to check for placement, and then inject the medicine. Once it's all in, I'll remove the needle and cover with a Band-Aid. Any questions? The medical assistant should demonstrate knowledge of infection control standards in patient care by washing hands before and after patient contact and demonstrating the use of gloves in patient care when clinically indicated. For this clinical task, the medical assistant should wash hands with soap and water or use a hand sanitizer prior to the use of clean, non-sterile gloves. It is important for the student to demonstrate his or her knowledge that it takes time for germs to die with both hand washing, hand sanitization, and use of alcohol wipes on patient skin. Don't rush through these important basic skills. While the medical assistant is washing hands, it's a good time to summarize the procedure for the patient and inquire if the patient has any questions or concerns. The medical assistant puts on clean, non-sterile gloves and verbalizes the landmarks used to identify the correct muscle for injection. The intended injection site is cleaned with an alcohol wipe in an expanding circular motion. The needle cap is removed and the needle is inserted at a 90-degree angle into the intended muscle at an appropriate depth. Unless injecting a vaccine, the syringe plunger is withdrawn to confirm that the needle bevel is not in a blood vessel. In the absence of blood return, the medication is injected into the muscle and the needle removed. Pressure may be applied to achieve hemostasis. Finally, a bandage is applied to cover the puncture site. Ms. Messino, I have an order to give 25 milligrams of compazine IM for your nausea. So I'm going to start first by checking your landmarks, cleaning the area. Going at a 90-degree angle into the muscle. I'm going to draw back to check for blood return. There's no blood return. Give the shot, remove. Cover with the Band-Aid, all done. The medical assistant safely discards the needle and syringe in a sharps container without recapping the needle. He or she then removes and disposes of gloves and appropriately washes and sanitizes his or her hands. The medical assistant correctly charts the medication, dose, route, site, and patient response. For example, Ms. Jane Doe received Benadryl 50 milligrams by IM injection to the left deltoid muscle. It was uneventful and well tolerated. Joseph Smith, CMA, 2/15/2018, 3:30 p.m.